Good morning, everyone. What a wonderful day to celebrate each and every one of you. On this International Nurses Day, I want to express my deepest gratitude.
In 1854, during the Crimean War, wounded British soldiers were brought to the Scutari Hospital in the Ottoman Empire, but the facility offered little relief. Riddled with infections, stagnant air, and toxic water, the hospital was killing soldiers faster than the battlefield. That November, Florence Nightingale arrived at this medical disaster with a team of 38 nurses. To stop the dying, Nightingale realized she had to unmake disease. As this historical text outlines, she defined nursing as the act of utilizing the patient's environment to assist in their recovery. She proved that medical treatment remains secondary when the physical surroundings fail to meet the body's basic needs. This diagram illustrates Nightingale's formal environmental theory, mapping a conceptual framework that places the nurse directly at the center of environmental control. She identified 5 environmental factors necessary for human recovery: fresh air, pure water, efficient drainage, absolute cleanliness, and direct light. As detailed in these notes, enforcing these strict principles codified nursing into a scientific discipline, replacing untrained labor with professional training schools. Over the next century and a half, that discipline expanded across the globe. Today, nursing is a specialized workforce of nearly 30 million professionals. But while the profession has attained this global scale, its reliance on a functioning environment remains its greatest vulnerability. This visualization tracks our modern global health workforce. According to 2025 data from the British Medical Journal, the number of registered nurses grew to 29.8 million by 2023. Yet the global healthcare system is currently missing 5.8 million of the nurses it needs to function. And that deficit is not distributed evenly across the globe. Look at the per capita density here. High-income regions like the Americas have roughly 72 nurses for every 10,000 people. In Southeast Asia, that number drops to 17. Specific national data reveals the depth of the divide. The Philippines maintains nearly 48 nurses for every 10,000 people, while India holds at 17.2. This geographic disparity ensures that most low- and middle-income countries will lack the workforce required to meet their 2030 universal health coverage goals. To understand why millions of nurses are leaving the system, we have to apply Nightingale's logic to the nurses themselves. Rapidly rising healthcare demands, escalating regional conflicts, and the increasing impacts of climate change are exceeding the capacity of existing hospital infrastructures. This forces nurses to operate in compromised environments. They exit the profession due to poor pay, unsafe physical conditions, and the destabilizing effects of forced migration. Burnout and attrition occur when the modern environment becomes as toxic and unmanageable as Scutari's wards. This graphic outlines Dorothea Orum's self-care deficit theory, which models exactly what happens when a human being gets sick. Orum argues that a formal nursing agency is activated when a patient's medical demands exceed their own physical ability to care for themselves. But scale that up. When the global nursing agency itself falls into a 5.8 million worker deficit, who steps in to bridge the gap? This threat prompted the International Council of Nurses to issue an urgent call to action for International Nurses Day 2026. Their theme: Our Nurses, Our Future. Empowered nurses save lives. Saving the healthcare system requires a shift in priority. Society must stabilize the environment for the nurses who provide the care. To recruit and retain this workforce, the ICN outlines required systemic changes: investments in safe working conditions, fair compensation, and closing the gender pay gap. True empowerment means eliminating institutional barriers and granting nurses the authority and leadership roles required to shape the future of care. It is the same logic Nightingale mapped out in the 1850s. You cannot heal the body without first fixing the room. Society relies on 30 million nurses to sustain health systems. We cannot expect them to save lives unless we provide them with an environment where they